Webster's dictionary defines sight as the process, power, or function of seeing. Specifically, the physical sense by which light stimuli received by the eye are interpreted by the brain and constructed into a representation of the position, shape, brightness, and usually color of objects in space. Right, so now that we know even less about vision than when we started, let's try and break this down anatomically. Before entering the eye, light hits the cornea, which bends and refracts it. The cornea is the transparent structure on the anterior part of the eye, covering the iris and pupil. Contact lenses are shaped after the cornea.
The pupil is the hole through which light enters the interior of the eye after passing through the cornea. Its size is controlled by the colorful muscle known as the iris. The pupil dilates to let in more light and constricts to let in less light.
Stop moving, both of you. This is Devil's Snare. You have to relax. If you don't, it'll only kill you faster.
Kill us faster? Oh, now I can relax. Hermione! Now what are we gonna do?
Just relax!
Just remember Hermione's example. She was relaxed when the devil's snare constricted. Likewise, the iris is relaxed when the pupil constricts.
After passing through the pupil, the light then hits the lens, which further refracts the light, allowing it to focus on the retina. The lens can also change its curvature depending on the distance of the object in focus. Cataracts is a clouding of the lens, which limits the amount of light that can pass through it. Symptoms include blurred or double vision, change in color perception, and a sensitivity to glare. Common causes for cataracts are age, genetics, some type of trauma to the eye or head, and radiation, specifically UV rays. Aside from a new prescription for glasses, the most common treatment for cataracts is a surgery to replace the lens with an artificial clear one, which is actually the most common surgery performed in the US.
The retina is the innermost layer of the eye and the location of photoreceptors known as rods and cones. It is also where visual information is received.
Rods are the photoreceptors responsible for black and white, peripheral, and low light vision. Cones are responsible for color, light, and sharp, clear vision. Just remember, rods see black and white, cones need color, need light.
The macula lutea is a structure on the retina that contains mostly cones. It is located on the posterior surface inside the eye. The fovea centralis is the centermost point of the macula lutea. It contains only cones.
Information is gathered by the rods and cones, but is interpreted in the brain. The pathway the information travels from the eye to the occipital lobe is the optic nerve 2, which attaches to the posterior surface of the eye at what is known as the optic disc.
Despite Webster's Dictionary's best efforts, we now have a better understanding of sight, and hopefully with increased understanding will come an increased appreciation for this gift we have to capture some of life's most beautiful moments.